Financial meltdown starts with new taxes. The IRS role in the new health bill doesn't stop with enforcement of the insurance coverage mandate. The National Review just got its hands on a GOP memo that said the new law just doesn't tax individuals and employers if they don't comply with the complex mandates of the bill. The bill sends the IRS out to tax the very products Americans use to maintain and restore their own health. New taxes on medical devices, on prescription drugs, and on health insurance itself are all targets of the bill. And now, with $10 billion in new enforcement resources, you can bet the IRS will be taking its full share out of the pockets of every American who uses any of these products or services. In other words, the new health care law is a classic read my lips, no new taxes moment. During his campaign, then Senator Obama said, "I can make a firm pledge under my plan no family making less than $250,000 a year will see any form of tax increases." I remember that one. Not your income tax, not your payroll tax, not your capital gains tax, not any of your taxes. Fred Lucas, staff writer for CNSN News, CNSnews.com, said as many as a dozen taxes in the new health care law violate President Barack Obama's campaign pledge not to raise taxes on families earning less than $250,000 and on individuals earning less than $200,000. The one that will undoubtedly feel the one that will undoubtedly affect the most people is the new level for medical deductions. Right now, you can deduct medical expenses that exceed 7.5% of your adjusted gross income. The new law raises that threshold to 10% of adjusted gross income. You'll find this huge new tax in Section 9013 of the new law. The government estimates this change alone will raise $15.2 billion in revenue. But there are several other provisions in the new law that will increase taxes for Americans making less than $200,000 per year. Higher taxes during a financial crisis will be the first steps towards a complete financial meltdown. Productivity is already down. Taxes will stifle it further. More importantly, new taxes will increase the government's control over individuals and corporations. In a fiat money system where the government can print all the money it needs, the only purpose for taxes is control and wealth distribution. These higher taxes will rob you of your wealth and damage your health at the same time. Think about it. I'll be back with the next one. Financial meltdown, unfunded mandates. A few months ago, we showed you how unfunded mandates from the federal government on state governments is wreaking havoc on state budgets. California is one of several states about to declare bankruptcy, partly due to unfunded mandates. Unfunded mandates are requirements placed on state governments to fund new programs without any financial assistance from the federal government. In other words, the feds force the government to pay for the feds' new programs. Of course, the states have to raise taxes to pay for the new mandates, but the federal government doesn't take the blame for the new taxes. The states do. This allows President Obama to raise taxes even more without taking responsibility for them. The repercussions, though, are far greater than broken campaign promises, with 48 of the 50 states already showing budget deficits for 2010. The financial burden on state governments is untenable. For some of these states, the new health care law will be the straw that breaks the camel's back. California is already on the brink. Illinois and New York are close behind. Many others are right on their heels. And the Constitution does not give the government the authority to mandate to states what they must do. think about this. Final goal: a move toward world health care standards. As with all of the federal government's plans, the goal is not just to control the United States. America's elite have bigger plans, in concert with the international establishment, to build control globally. Along with such schemes as global warming, globalization, and uncontrolled immigration that we've also detailed in these pages, the new healthcare law fits right into elite plans to bring the U.S. into an ever more powerful and intrusive world government. According to CNN.com, Senator John Kerry, chairman of the State Foreign Relations Committee, remarked that a strong global public health system is not merely a favor we do for other countries. It is the right thing to do morally and strategically, and it protects our own citizens. The Democrats assert that a global public health system, apparently administered by a world government, will help prevent wars. Former President Bill Clinton said in remarks to the committee, "We have to build a world with more partners and fewer adversaries, and that's what foreign policy is about. If people think you care whether their children live or die, you don't have to send our young people off to war as often." Some truth in that. However, more than just Democrats will be involved, Kerry said. U.S. work on global health issues would be strongly bipartisan, such as President George W. Bush's Emergency Plan for AIDS Relief, REPFAR, and the reauthorization of the measure in 2008. During these meetings, Kerry disclosed plans by the Obama administration to take the global health care system one step further than Bush. The CNN.com article continued, Kerry also said that an Obama administration proposed global health initiative. Kerry also said that an Obama administration proposed global health initiative has identified principles beyond the vertical silo of any one disease, focusing on women and girls who are at the center of each family's health, and empowering other countries to eventually assume full responsibilities for their citizens' care. Kerry said the administration is finalizing the initiative. Obama's plans are not altruistic. They are clearly focused on government control of health care. This initiative starts with individual countries taking control of health care, then moves it to the international government, as Kerry outlined. We've detailed the plans of the World Health Organization to globalize health standards through Codex Alimentarius in previous issues. The new health care law takes the U.S. one step closer to adopting the international treaties of the WHO and show other countries how to follow our lead. One more time, folks.